Hello, my name's Janet Chapman from Crowd2Map Tanzania, and I'm talking today about building mapping communities in rural Tanzania. About 7.5 years ago, I became a project officer and later trustee with Tanzania Development Trust, or TDT. This is an entirely volunteer-run charity registered in the UK that's been supporting grassroots projects in rural Tanzania since 1975. So we have no staff, no offices, we don't pay expenses when we visit projects, and so all of the money raised goes directly to projects. So we support typically rural villages in very undeveloped areas of Tanzania, such as the north, the west and the south, so far from the tourist centres of Arusha, Zanzibar and Dar es Salaam. So this will be a typical village that we support. So this is called Zeze village. I know it extremely well. I visited it over 10 times now, and it's near to the Burundi border in western Tanzania. So before we started supporting them, people would typically get water from dried up riverbeds such as here. So obviously this leads to huge health issues. So we funded the local community to dig for water themselves, so that they set up a construction like this. It took them 6 days to reach water. They created a borehole, and then they built themselves a simple rope pump like this, which is really excellent for getting water. Some of the benefits for a scheme like this is that because it's locally made, it empowers local people to learn new skills, but also it means when it breaks down they can repair it themselves. Because typically with water boreholes, up to 45% are unoperational at any one time in places like Tanzania. So we also support income generating projects. So in a village like this, people will be living on way less than $1 a day. So simple income generating projects can have a huge impact. So this is one where women were supported to start small businesses, such as in food production, as here. So since I became a project officer and trustee, I've tried to spend at least 2 months a year in travelling around rural Tanzania, visiting our projects on roads like this. So typically, especially when it rains, the roads get extremely hard to travel on. There's no maps, or there wasn't when we started, no road signs, no street lights. It can be extremely difficult, particularly when it rains, because then the roads are terrible, and also there are no people out to ask directions. So in 2015 I was visiting this school, Ikondo, and it was raining. The person I was with didn't know where it was, so we drove around for 2 hours looking for the school, constantly phoning them, the school phoning us saying, "Where are you? We're waiting," etc. It was extremely challenging and frustrating. I live in London. I'm used to having maps. I'm used to being able to just put something in my phone and know where I'm going. Rural Tanzania was not like that at all. So this was extremely frustrating for me and them. So schools like Ikondo, they're in remote areas. Their students walk extremely long distances to and from school, sometimes up to 2 or 3 hours each way, and they have often they even have to carry the water that they then need to clean the classrooms with. So extremely challenging circumstances, and girls in particular have additional challenges in that they are put into vulnerable situations. When the students are ill, as in here, this student from Ikondo has malaria. There's no ambulances, so the students are carrying him up the mountain 2 hours to the hospital. Here is the school here. There is a hospital 2 hours up the mountain. So Ikondo School had this building which was supposed to be a head teacher's house. It was unfinished. They wanted to turn it into a girls' hostel. So TDT funded them to do that. So now they now have had a hostel. All of the girls that came to the school, that was over 300 girls, really wanted to stay there. There were only 50 places. So it was very difficult for them for the school to decide who should have those places. So we trained the teachers and the local people to actually add where the places where the girls came from onto the map. So they trained the girls. We had a few cheap smartphones, so the phone went home with one of the students each day and came back, and they had added the places in their village. So from that we were able to teach them how to add all of those places and create a simple map. This was the first time the school had any idea where the students were coming from and how far they were, and from that they were able to select which students were the most deserving to come. It wasn't only based on distance, it was also based on their vulnerability, whether they were single parents, families, etc. But distance was certainly important, and they were really delighted to have a map showing where the students came from. And these are some of the girls who were selected for the hostel, who were delighted to be there. Girls have additional challenges because they are also expected to collect the water, collect the firewood, etc. So being in the hostel gives them additional opportunities to study in the evening, which they're extremely grateful for. So rural Tanzania, generally it looks something like this, or it certainly did when we started, as opposed to Dar es Salaam, which looks more like London, partly because of excellent efforts by people like Romani Huria and OpenStreetMap for Development Tanzania that have had World Bank money to do a really excellent job in mapping Dar es Salaam, particularly for flood resilience. So rural Tanzania really needs maps, and we've been working with many different places to help do that, and this is a short video showing some of the reasons why they do need maps.
Mapping Serengeti district, especially rural areas, is very, very important. This can help us as Safe House staff to see how to reach those girls who will be in danger in their rural villages.
Officials can use the map to locate where the schools, clinics, and the community centers are in order to plan for the future development of other services that are needed in the community.
We use the smartphone that we have to map different areas, especially in villages where most of vulnerable people and groups live there. So we managed to map different local government offices, water point, population center, and the different areas in local villages in Simiyu region.
Thanks to our HOT micro grant, we have been able to buy phones for mapping, and we have trained youth mappers in rural areas, whereby more than 200 mappers we have already trained.
The maps we have produced will help activists fighting FGM to better protect girls at risk, local officials to clearly see where schools, clinics, water points and population centers are now, and a better plan future provisions. Over 1.8 million households are on the map. For the first time, and the local people in 10 areas of rural Tanzania now have access online and on paper to maps of their villages that they have created themselves. So, asante sana, HOT.
So that was actually quite an old video. That was from 2017. So since then, we've actually added over 4 million buildings now, and we have around 14,000 online volunteers. But the need for maps is still there. So this is an example of maps that we want to start creating, showing how far people have to go to water points from health facilities. Typically, many of the health facilities do not have running water, and it can be quite a long way from them. The village that I mentioned at the beginning, Zeze, they are particularly interested in creating a land use plan. This is something that is could be extremely useful, and we're starting to do a joint project with the OpenStreetMap for development in Dar es Salaam to pilot cheaper ways to do very accurate mapping that will be useful for land cadastres. But as I said, we've been training people to use maps.me. However, when we first started, this would be a typical screen that you would get on maps.me. So no roads, no buildings already added. It's extremely difficult, particularly if you're using a cheap smartphone, which we are, to actually work out accurately where your location is. So we've been recruiting people, so now we have over 14,000 online volunteers, the majority of whom have come from UN Online Volunteers and other online volunteering sites. They're from all over the world, and they're helping do the base map, adding the roads and the buildings, so that local people can then add their points of interest in their villages. So this is a typical satellite image showing some round buildings here that we're adding. So when people sign up to our online volunteering, we've got some very comprehensive instructions now, because we're doing all of the training online. So we're also using Rapid now, which is machine learning generated roads and buildings, to help with the mapping. And we're using the comprehensive tagging guide for African roads with some pictures to show people, because many of the people will never have been to these areas. We have a very comprehensive Slack channel. We have over 4,500 people in there now. So when we have new mappers, we ask them to join the Slack channel, introduce themselves, but then to ask for feedback on their first mapping attempts. Then we have some extremely experienced mappers who then give them feedback so that they can improve their mapping. We've also set up a number of online tests to help particularly new mappers, so to ensure that they really understand how to map well. And these tests, if you get, they're full of screenshots, etc., like this one, and if you get 100%, then you can get a badge. So if you're interested in that these are we've so far we've done the buildings one. We are producing the other ones for roads and many other things as time goes on. So we've made huge progress. This shows an area of where the FGM safe house is. So Google is just showing this. You can see the example from OpenStreetMap, a huge. We've come a long way. So we have really two mapping communities, the remote mappers and the community mappers. And they're extremely different communities, and we engage with them in different ways. So the remote mappers generally are very educated, often they're graduates. They've been using maps throughout their life, so they're very experienced in using maps on their phones, on paper, etc. For navigation. They generally have access to a large range of technology. They generally have at least a laptop, a smartphone, good internet, in their place of work and at home. If we contrast that to the community mappers, many of them did not complete secondary school. Some of them never really went to school at all. There have been no maps available of their local area, so they haven't used them. Most of them hadn't used a smartphone, or if they had, very, very intermittently. Very few people had access to a laptop or even been online before. And access to technology, access to connectivity is a continual problem. So most people live in villages that are out off mains electricity. So if they're lucky, they have access to solar for charging, but that's generally problematic, especially during the rainy season. And getting online is expensive and infrequent. So people don't have the luxury of a connection all the time. So one of the things that we've been trying to do to build our community over the long term is to go to places like universities, where people do usually have a degree, some more access to technology and internet usually. So, but some of the training in universities has been more like this, i.e. standing at the front with one phone, very few phones available, very few laptops, etc. The Wi-Fi doesn't work, often the electricity's gone off, etc. So very extremely challenging circumstances. And when there are laptops, there are a few, and people have to share. And generally, the people have not had access to technology all the time. So you can assume that you can't assume that they've. You can't assume anything really. This is setting up the Youth Mapper chapter at the Institute of Rural Development Planning. So we were setting up the committee. So we told them that we should have 2 men and 2 women. When we asked for volunteers from the men, everybody put their hand up. When we asked for volunteers from the women, nobody put their hand up. So there are very traditional roles, gender roles in rural Tanzania. So, it takes more of an effort to get women to come forward. Eventually, women did put themselves forward. They just needed a bit more encouragement. And actually, when they got involved, they were actually more capable than the men. Also, if you're sharing equipment, this will be a typical scene. So you have one laptop between 5 people, and of course the man has his fingers on the keyboard. So and also when we were doing the mapping training in the villages, generally it was men have much greater access to smartphones than women do. So when we got the Hot Micro Grant in 2017, it did enable us to recruit a lot more female mappers for the first time, because we were able to buy cheap $30 smartphones and train people. However, female mappers in rural areas do face additional challenges. A lot of men told them that they shouldn't be out doing mapping, they should be at home in the kitchen. They had quite a lot of harassment and threats, even inappropriate touching and plots to try and lure them into remote places. But the women mappers that we trained were extremely passionate about mapping, because they saw very quickly that mapping was important to the community, and it was actually a means towards greater gender equality. So women learning skills about using phones, about putting their communities on the map, about being treated equally. And one of the initiatives that we've been very involved in is mapping against female genital mutilation and gender-based violence, which is very prevalent in certain areas. And I've done a lightning talk around that if you're interested. So why do women keep mapping in these, even though that they are subjected to this harassment and even danger? So they're passionate about developing their communities and protecting girls from female genital mutilation and gender-based violence. But they also want to help other women in their villages, learn some digital skills and to be part of changing their communities more generally. So the mapping community can really help this, I think, to recognise that rural women in places like Tanzania face a lot of additional challenges, and they do need encouragement. So, to participate. So things like women-only groups, role models, being mindful of male domination in training activities are really important. And we've really tried to map aspects that are of importance to women, such as FGM and gender-based violence, but also access to clinics and water points, also particularly is of importance to women. And it would be really good, I think, to have more materials on why mapping rural areas benefits women. And there are additional funding needs, because women are much less likely to have access to technology. So to help with this, we've set up digital champions in all 87 villages in Serengeti, where FGM is a particular problem, with a smartphone for the first time, and they have access to SD content on the smartphone, which has a lot of material around education, health and FGM. So these women digital champions are linked together in a WhatsApp group that enables further training, and they help monitor the status of women in the village, protect any girls, but they're also responsible for mapping those villages. And this was part of a project called Women Connect that started in 2019, but we're continuing it because we recognise the value of this, despite the fact we no longer have any funding. So this shows some of the new smartphone users in villages seeing a map of their village for the first time on a phone. We've also been adding clinic locations from open government data, and also using water point location data to add village names, which is particularly useful for COVID contact tracing, but also to develop the map. So now we have almost 14,000 volunteers, online volunteers, and we've added 6.4 million edits. We were recently featured in a podcast if you're interested in learning more. So we've tried really hard to build the mapping community in Tanzania, particularly in rural areas. So in 2017 we organised the first State of the Map Tanzania. So this was held in the University of Dar es Salaam, and we were able to get some small funding to bring people from rural Tanzania into Dar es Salaam for this 3-day conference, and also some youth mappers from other East African countries. So this was an extremely big deal, particularly for some of these rural mappers. For many of them, it was the first time that they'd been to Dar es Salaam. It was the first time they'd been to a university, and the first time that they'd met volunteers from overseas, particularly, and actually benefited from some mapping training. And we would really like to repeat this at some point. We've also organised open data events. So this one was in 2018 in Mwanza. Again, we were able to get together and bring some people into Mwanza to the Institute of Rural Development Planning from remote rural areas. And I've met many of them since, and they still talk about this. It was a very big deal. And we had an event this year in March as well. So this is something which really helps build the mapping community, and we thank everybody that helped with these activities. So we've trained many people on Maps.me and the use of maps. So we train local government officials, the police. So the police particularly liked Maps.me. It helps them to get quickly to places, particularly in the middle of the night. The girls at risk of FGM, typically the activists and the police will get a phone call in the middle of the night saying girls are about to be cut in Kabancha village. Without maps or road signs or street lights, it was very difficult to get there. Now they have been trained in Maps.me, and we've mapped those areas. It's much more easily to find them. So here are some digital champions seeing a map of their village for the first time and adding those places that are missing from the map. So having better maps has helped protect many girls from FGM, and we've trained people all around rural Tanzania now. In 2018 we were invited to organise a mapathon at the United Nations General Assembly, and we had marathon events, satellite events in 60 different countries, and here are some of them. So thank you to everybody who helped with that. So lessons learnt. Engaging rural communities is extremely hard. So there are issues with almost everything. Issues with setting up the phones, with charging the phones, with access to connectivity, training. You generally have to start with quite a low base, so you're starting the training with, how do you use a smartphone. But it's extremely rewarding. So people, generally, many of the community mappers have not had access to many educational opportunities, so any training opportunities that they get are hugely appreciated. And although at the beginning people found it difficult to envisage what the benefits of mapping their communities were, now they really get it, and they're very passionate about putting themselves on the map. Women have additional challenges, and that I think should be recognised by the community. Building relationships is key. You need people, you need to be working with people who trust you, and to build up that trust takes time. Otherwise people can't really see, they have to own the project themselves. So this for us is a long-term project. We're keeping building up the map of Tanzania as long-term. So please help us. We're all volunteers. We have no funding. Many of us, including myself, are not GIS experts. So if you would like to get involved, those are my contact details. Please get in touch and help us map Tanzania. Thank you.